Punjab, the land of 5 rivers, is known for its energetic people. The sons of the soil here are full of enterprise and pioneering spirit. Their zest for life is unmatched. Time and again, they have shown how to cope with challenges that deter others. An essential part of Punjabiyat is love for good food and good health. Ludhiana is a bustling industrial town that epitomizes a resurgent, progressive Punjab. And this is where began the inspiring saga of Dayanand Medical College. Inspired by the teachings of Swami Dayanand, some of his followers had started a small medical school in the year 1934. In 1964, it became a full-fledged medical college. This is where the old building of DMC stands today. This was the result of the tireless exertions of Sri Premnath Ji and Sri Brij Mohan Munjal Ji, public-spirited industrialists in the city.
The time being given and the technology being used, not only professional technology, management technology, because we are all business people. We are running our big houses, very, very big houses. So all that knowledge which we acquire in our own businesses is transferred to that institution.
What we have now done in more recent times is to build an environment where everybody feels that I belong here. There is a sense of participation in decision making, in day-to-day affairs, and that sense of belonging brings about a sense of pride, and therefore everybody is trying to do the best for himself or herself in that place. So basically we are trying to encourage the intellect amongst the people. We are trying to encourage people to think for themselves. We are trying to encourage people to build that sense that I am going to build this place for myself.
The small sapling has grown into a massive multi-branched tree. The Dayanand Medical College is ranked among the top medical colleges in the country.
This is a hospital run by the community, some trustee of the Ludhiana and Arbitration Sabha members. He is a charitable hospital, no profit, no loss, run by the society.
With the motto of best medical education and patient care, DMCH has a 1,000-bedded hospital served by about 170 faculty members and 20 other consultants, 60 senior residents, about 250 PG residents and other doctors, and 400 undergraduate students. There are a total of about 3,000 employees working in various departments. DMCH provides MBBS, MD and MS along with diploma courses in 16 subjects and super specialty courses in 3 subjects. It also has a college of nursing that has 30 nursing teachers and 500 nursing students, offering BSc degree, GNM and post-basic courses. The annual turnover has rapidly increased over the past 4 years from rupees 60 crores to rupees 130 crores.
This is achievement of my junior colleagues who have done tremendous work, and I have praise for each and everybody. You see, the work can never be done by one person. It is always a teamwork, and I am really proud of all my students, of all my colleagues. I always wish that this college should go on improving because there is no room for complacency.
The steady progress made by the DMC owes much to the vision of its pioneering principles.
You see, there is a concept in other places that if you have super specialists, the growth of the main specialty is hindered. Fortunately, myself, Dr. Chawla and Premnath Ji thought the other way around, that if we develop super specialties, the whole place grows. That is how first we started with super specialties like cardiology, nephrology, then gastroenterology, then oncology, and surgical super specialties like plastic surgery, like urology. And gradually we went on adding, and we got the best super specialist.
The management here has its role by virtue of selecting the best in the field. And then they had played their role by giving them all the inputs, whether it is equipment, whether it is the development of a technology or an expertise. Now that translates into the best professional care and education.
The DMC for most of the people is synonymous with a large ultra-modern teaching hospital attached to it. The Dayanand Medical College and Hospital provides medical relief to thousands of patients every year. Among them are patients from neighboring states like Jammu and Kashmir, Himachal, Haryana, Rajasthan, Uttar Pradesh and Uttaranchal, and at times even from Delhi. This is because of the impressive array of specialists and super specialist doctors that are available here.
A place is as good as the people are, and there has been a marvelous system of getting the best people here. For example, we have a faculty of about 165 consultants of all fields, and that includes almost 30 super specialists. All the known super specialties are represented here, and they are all very highly competent, very highly trained. In fact, the selection process of the senior doctors and the consultants is such that for every post there is a line and you can choose the best. It's a very attractive place to work in. If you just see the youngsters who want to join here, they know that they have a relatively free hand in doing their work.
The students are taught by a well-qualified specialist in a classroom equipped with the state-of-the-art audiovisual equipment. The instruction in anatomy includes cadaveric surgery, and the students have access to a well-maintained museum. The physiology classes are enlivened with experiments involving students and giving them hands-on experience in handling sophisticated equipment. Once they gain knowledge about the normal functioning of human body, they move on to the pathology class. The classes are interactive and great emphasis is put on acquiring and honing skills in lab work. Microbiology and biochemistry provide the solid foundation for professional training of budding doctors. The DMC has acquired an international reputation and attracts students not only from all over India but also from many developed countries.
All admissions are made through the pre-medical entrance test. Even postgraduate admissions are made through postgraduate entrance test. With the result that we are getting top class students who are performing very well. For example, even the NRIs which we are getting, they are performing very well when they are in States or in Canada and a few from UK also.
So we have a lot of modern equipment, and since we have smaller classes, it's a lot more helpful. We get more individual attention from teachers, and they care a lot. Like, if we have problems, we can go to them.
No other place in Punjab, and as far as Northern India is concerned, so no other better place than DMC. So that was my prime reason for joining DMC. And sir, I plan to specialize in orthopedics.
It's ranked 25th in whole of India and best institution in Punjab to study. So the faculty is good, the placements are good.
It's been really wonderful to be part of such a nice institute which is ranked amongst the top colleges in India.
There is a nursing college that reinforces the work at medical college and the hospital. In the nursing college also, suitable emphasis is put on practical work that enables the students to gain self-confidence. The students in this institution are also encouraged to master the latest development in the field. It is easy to understand why the brightest students are drawn to the DMC. The college has a well-endowed library with latest books and a large number of specialized journals. It has an ambience that encourages pursuits of scholastic excellence. To reduce the tedium of drudgery, there are facilities like a cyber cafe. Comfortable residential accommodation is provided for boys and girls. The Domra Auditorium within the campus of DMC provides a convenient venue for professional seminars and symposia. This is where the convocations are held, and it is also the venue of colorful co-curricular activities around the year. As one steps into the OPD, it becomes clear that this is a unique institution. The interaction between the doctors and the patients is exceptionally personalized and compassionate. The patients, many of them not highly educated, are not intimidated by aloof specialists and are greatly reassured by this initial encounter. After a thorough clinical examination, they are prescribed specialized tests as per individual requirements. The management of the hospital has thoughtfully planned for and put in place facilities to reduce the hassles of the sick and their accompanying attendants. The system of single window clearance for collection of samples and delivery of reports has greatly reduced their distress. The DMC also provides a service to collect samples from patients' home, greatly reducing their stress. This achievement should not be underestimated. The DMC is one of the largest healthcare institutions in northern India. Successful practice of modern medicine depends critically on competent diagnosis. The DMC has state-of-the-art equipment manned by specialists to ensure that the patients here get the best facilities that are available anywhere else. Extremely sophisticated and sensitive machines are used to perform pathological and biochemical tests. These ensure that even while extremely large volumes of samples are handled, greatest possible accuracy can be maintained. As sophisticated machines are used for all these tests, the chance of human error is eliminated. A much greater degree of accuracy can be achieved, and the patient is ensured that the course of treatment prescribed is based on most reliable diagnosis. Quality control is a priority, and diagnostic laboratories at the hospital, including transfusion medicine, are ISO 2001 certified. The Department of Radiology has facilities ranging from digital X-rays, ultrasound, interventional radiology and spiral CT scan. And recently 1.5 Tesla MRI has been added. Advanced nuclear medicine services in the form of state-of-the-art SPECT CT scan, one of the latest non-invasive techniques, are being set up for advanced cardiological care at Hero DMC Heart Institute, as well as bone, thyroid and renal scans for other patients at DMC Hospital. In the plastic surgery department, latest equipment allows the doctors to perform cosmetic treatment flawlessly. The Department of Ophthalmology handles a large number of patients suffering from a variety of eye ailments. It has facilities for eye angiography, laser surgery, and is renowned for its pioneering work in vitro-retinal surgery. The work is delicate, but the proficiency of surgeons here guarantees almost 100% success rate. Hearing impairments, often invisible, are severely disabling. These are corrected expertly in the well-equipped ENT department. The DMC is renowned for orthopedic surgery. A wide variety of injuries and congenital deformities are treated by specialist surgeons using state-of-the-art equipment. This kind of work requires great patience and skill on the part of the doctors. Often the same patient has to undergo more than one procedure. This department literally puts hundreds of patients back on their feet and assists many others to regain the use of other limbs. Patients in orthopedic wards require close monitoring for a prolonged period. Speedy recovery requires patience and perseverance on part of the doctors as well. This is what they receive here. Physiotherapy plays an important part in the full and fast recovery of patients suffering from trauma and orthopedic ailments. The DMC has made excellent provisions for this. The course of physiotherapy is custom tailored to individual needs, and the follow-up is supervised by specialist physiotherapists. Special attention is given to pediatric patients and those with special needs. The Department of Obstetrics and Gynecology deals with complicated delivery cases including cesarean sections in high-risk situations and various types of gynae surgery. Latest researches in modern medicine confirm that breastfeeding by the mother provides best nourishment to the newborn child and boosts its immunity. This practice is encouraged here. Everything that is required by the newborn is provided for in the nursery. There is an uninterrupted supply of tender, loving care. Doctors and nurses are constantly round the clock. There is constant monitoring of the state of the health of the newly born child. For those children born with congenital disorders, there are specialized facilities for lifelong care. The problem of children suffering from thalassemia is a serious one, as safe blood transfusions are required throughout the life.
इस जगह में बहुत फ़र्क है, मैडम बहुत ध्यान रखते हैं, सभी स्टाफ भी बहुत अच्छी तरह से मतलब देखते हैं पेशेंट को. खर्चा कम है, वहाँ पर हज़ारों में आता था, यहाँ पर 400 है.
The well-equipped blood bank and specialist hematologists ensure that the patients here receive the full benefit of latest advances in transfusion medicine. Optimal use is made of each unit of blood received by separating its components and using these as per requirements. There are many super speciality departments in the hospital that have carved a niche for themselves.
We were first one to start the bronchoscopy in Punjab, fiber-optic bronchoscopy. After PGI, our was the only institution. This is a very simple procedure. The instrument's thickness is less than even a stethoscope, which can pass through the nose. And it is done just under local anesthesia. And we can keep seeing what is in the main windpipe, what is in the side. And then we can take the washings, we can take biopsies of the lung.
The diagnostic endoscopic procedures like upper GI endoscopy and colonoscopy are available at most of the centers outside. As far as the therapeutic modalities are concerned, where some sort of ulcer bleed has to be tackled or the common bile duct has to be opened and stones taken out, those are the therapeutic modalities which you become better as you do more numbers. And in our institutions, we are lucky that we have been doing this for the last more than 12 years. And we have a sizable number and we have got some of the best equipment.
These non-invasive procedures today are used to avoid expensive surgery in many cases. However, there are conditions that can only be treated with operations. This hospital has acquired sophisticated medical equipment that makes it possible to perform laparoscopic surgery. Here, in this hospital, it is routinely used to bring relief to patients suffering from stone and other painful conditions of the gallbladder. The bladder, if need be, is removed without exposing the patient to major trauma or blood loss. Such an operation does not require a long stay in the hospital after the operation. A captive power plant ensures uninterrupted power supply required by all critical areas. The hospital also maintains an oxygen plant with adequate capacity to meet all its requirements. The emergency medical care which is available here is the envy of many a large hospital in big cities. The doctors on duty here follow the triad protocol. Although it copes with a large number of casualties, the place is maintained spotlessly clean and even sudden rush of patients does not fluster the attending doctors. Everything here works with clockwork precision. The emergency ward is equipped with all the required equipment and life support systems.
The reputation which Department of Medicine enjoys in this part of the country is such that almost all kinds of critically ill patients are now being referred to this institution. An exclusive intensive care unit of about 100 beds was started about a year ago, and it's running very successfully. The treatment of critically ill patients in this region has remarkably improved.
Dayanand Medical College and Hospital is famous for the quality of critical care it provides to the patients. There are specialized intensive care units to cope with the special needs of the patients. An entire floor is dedicated to the most critical patients, where they are kept on life support system until their condition stabilizes. The ICU wards are a pride of this institution. Elsewhere, the patient has to pay exorbitant fees for similar facilities. Here at DMC, the latest life-saving equipment and best quality medical care is provided without making any compromises at an extremely reasonable cost. There are specialized ICUs for pediatric patients and those referred by pulmonology and neurology departments. The ICUs are equipped with the state-of-the-art apparatus like respirators and ventilators. No expense has been spared to provide bedside monitoring of vital functions. The patients are in charge of a team of highly skilled doctors who remain constantly vigilant and are capable of handling any contingency. There are super specialized ICUs in the hospital that are non-existent elsewhere. The ICU Burns is one of its kind in northern India and has saved many lives. Hero DMC Heart Institute, which is the unit of Dayanand Medical College and Hospital, provides the critical care for the heart patients. The cath lab is fully equipped to perform angiography and angioplasty. The Hero Heart Center also has the state-of-the-art facilities and a team of super specialist surgeons to perform all kinds of heart operations. Great pains are taken to ensure post-operative care, speedy recovery and rehabilitation. Provisions of such sophisticated facilities instill the confidence in the minds of patients to undergo major surgical operations here without any apprehensions. Many patients visit the hospital for the removal of large painful tumors and return relieved of their distress thanks to the skills of accomplished surgeons. The nephrology department in the hospital is seen as a great ray of hope by the patients suffering from renal failure. Dialysis, the treatment commonly prescribed, is normally an expensive and tedious procedure. But here, it is provided in a user-friendly manner that greatly reduces the distress and the suffering of the patients and even their attendants.
एक महीना ਅਸੀਂ ਐਡਮਿਟ ਵੀ ਰਹੇ ਹਾਂ ਉੱਥੇ ਸਾਡੀ ਦੇਖਭਾਲ ਬਹੁਤ ਚੰਗੀ ਤਰ੍ਹਾਂ ਹੋਈ ਹੈ ਜਿੰਨਾ ਸਟਾਫ ਨਰਸ ਜਾਂ ਕੋਈ ਵੀ ਜਿੰਨੇ ਕਰਮਚਾਰੀ ਨੇ ਬਹੁਤ ਚੰਗੀ ਤਰ੍ਹਾਂ ਦੇਖਭਾਲ ਕਰ ਰਹੇ ਨੇ ਕੇਅਰ ਪੂਰੀ ਹੋ ਰਹੀ ਹੈ ਜੋ ਕਿਸੇ ਟਾਈਮ ਦੇ ਨਾਲ ਜੋ ਮਰੀਜ਼ ਨੂੰ ਤਕਲੀਫ ਹੁੰਦੀ ਹੈ ਤਾਂ ਉਹਦੀ ਦੇਖਭਾਲ ਹਰ ਟਾਈਮ ਦੀ ਟਾਈਮ ਕਰ ਰਹੇ ਨੇ
There are some cases where dialysis is not enough and a kidney transplant is the only ray of hope. This hospital is equipped to perform the most difficult kidney transplants. The process is complicated and long drawn. In a kidney transplant, 2 operations have to be performed at the same time. First, an operation is performed to remove a kidney from a healthy donor. The second operation replaces the diseased and damaged kidney with the healthy new one. The surgeon has to ensure that the replacement is functioning normally before the operation can be considered successful. The whole process takes hours and requires exceptional skill and endurance on part of the entire surgical team. The most remarkable achievement of the DMC has been to carve a niche for itself as a multi-speciality hospital.
All the technology of bypass, transplant, dialysis, everything is here now. So you don't have to travel abroad to get the treatment done. You can get competent doctors here right in the institution.
The management of the hospital is sensitive to the diverse needs of the patients and their attendants. The prayer room is there to provide solitude and solace. Realizing that the visitors to the hospitals also have other requirements, the management has thoughtfully provided for such needs. There is a drugstore on each floor so that the patients and attendants do not have to wander about to obtain prescribed medicines. There are cafeteria placed equally conveniently, providing nutritious and hygienic refreshments. Bank extension counters and ATMs make it possible for the visitors to carry financial transactions without stepping out of the hospital compound. The Sarai provides clean and comfortable budget accommodation to those who may require it.
This is a teamwork from Safai Karmchari to doctor. We have team. One is the management, one is the faculty, one is the paramedical staff. We are one.
The smooth functioning of the hospital is made possible by the back office operations. The accounts department crunches mind-boggling numbers to promptly prepare the bills and other accounts. This makes it possible to cut down the queues at the time of registration and discharge. The legal cell complements the work and also facilitates the disposal of insurance claims. A well-maintained record room facilitates access to current and old histories of the patients. Great emphasis is put on computerization of operations and implementation of management information systems. The hospital enjoys the confidence of a multitude of patients due to the outstanding nursing services that are available here.
Every employee of Dayanand Medical College is an important part and parcel of organization. We are committed to their mental and physical well-being. All the employees and their spouses are given free treatment. For that, they are medically insured and the premium is paid by the organization only. Recreation activities like sports event and culture event are a regular feature. So we feel if the employees are not taken care of, they cannot give good output. That's why I feel they are a very, very important part of the DMC organization.
These vibrant events provide matchless opportunities for bonding, encouraging team spirit, and fostering a sense of belonging to a proud family. Apart from taking great care of the employees, there is a constant endeavor to upgrade Medicare.
In medicine, things are changing very fast. New equipment, state-of-art diagnostics and therapeutics, they keep coming. So we'll keep pace with that, and we envision that over the next decade, whatever new high-tech equipment is available in different specialities, we'll be around the first to get it, so that we take the lead in this particular sphere.
We have assigned an expert team right now, which has a lot of experience of medical institutions both within India and overseas. They're drawing up a master plan as to how DMCH should look 20 years from now, 40 years from now, and now besides doing that, we're also drawing up phases how we can actually get there in different steps. So this addresses not just the patients, it addresses the students, it addresses faculty, it addresses non-teaching staff, it addresses the attendants who come in with the patients, basically the entire universe around the institution itself.
The doctors and the staff at the Dayanand Medical College and Hospital are quite conscious that there are miles to go yet, but the striving continues. The pursuit for excellence goes hand in hand with compassionate patient care. The seeds sown by the founding fathers long years ago had soon spawned a promising sapling. That sapling has grown into a large banyan tree, providing shelter, support and succor to countless people.